It appears that our COVID patients are requiring mechanical ventilation for a period of several days to even weeks. Respiratory therapists are formally trained on how to use these devices and how to use them safely and effectively in order to breathe for the patients that are really struggling to breathe. And we're seeing just a lot of patients now that are really struggling to breathe. ARDS, or acute respiratory distress syndrome, where their lungs just don't work properly. And what we are finding is the problem is their oxygen level is very low. And so we use these devices to give them all the oxygen we can give them, but we also give them the pressures they need in order to help keep the lungs open and keep the little sacs inside the lungs open and clear as possible to make sure they can get the oxygen into their bloodstream. In a lot of cases, they require these devices. It's a way for us to help save their life. It's just so many people that need the breathing machines that just simply haven't been manufactured yet. So running a ventilator is not just turning it on and turning a few knobs and the patient doing okay. It actually, to be competent at running a mechanical ventilator, it takes hundreds and hundreds of hours to learn how to not only place the device on a patient, but to interpret the data, interpret their lab results, and interpret the graphics and things on the screen to know that not only are you delivering the breath to the patient, but you're delivering the most effective breath to the patient you can, and you're also doing it safely, knowing what to do when things aren't going well, right? And so it takes a really deep understanding of pulmonary physiology, and it takes an understanding of the mechanical ventilators themselves, and you know, the many settings and strategies that we use to breathe for patients effectively. We all go into this wanting to take the very best care we can of our patients, and I would hope that the numbers, you know, we don't get overwhelmed, and which will allow us to provide the best individual care we can for all of our patients and help them survive.